Thank you so very much. I really can't tell you what an honor it is to be here. And thank you for that wonderful introduction. It's always I wonder when I'm being introduced who they're talking about. It's like, wow, I really want to meet her. That's awesome. Because when I started out, I was usually referred to as just a shelter vet. Oh, she's just a shelter vet. So I've come a long way. Shelter medicine has come a long way, and it's great to see so many faces here, both, I won't say old, but both that have been around and new, young and eager faces. So thanks so much for having me. I've had kind of an eclectic path in my career these last 25 years, and so I want to share a little bit of that with you and also highlight some of the activities I've been involved in and how I've come to understand that shelter medicine is public health. Okay? So I just returned this week from Ethiopia, where I spent 10 days. We were working on mass vaccination campaign training with the University of Gondar, and this is actually a view from one of the mountains in Gondar. It's a beautiful area. This is Addis Ababa, the capital city, which is about the size of New York City. It's a huge, massive city, if you could imagine New York City without any regulation on pollution and lots of diesel cars. That's Addis. Lots of building, lots of advancement going on there. And this is a view from Lalibela up in the highlands. I wanted to share a couple pictures, one, because I just took them all in. I'm still mentally kind of in Ethiopia, but two, because it's not all desert. It's really quite green, and it's a beautiful place. And there are a lot of dogs there, which is why we go. We'll talk a little bit more about that in a little bit. But what I really wanted to share was one of the things that happened while I was there. So the Global One Health Initiative is part of the Ohio State University. We have 7 health science colleges all together on campus and working together to do One Health work in East Africa and actually other places in the world as well, very active. One of our larger initiatives is the Summer Institute that we conduct every summer for the last 10 years in Ethiopia. We bring faculty members to give education and professional workforce development on different topics, all pertaining to One Health. And a year or two ago, we started bringing faculty from other universities as well. So this year we had UC Davis faculty, and we also had Cornell faculty. So you may recognize Dr. Karen and Carolyn's nose as we enjoyed a nice dinner at a traditional Ethiopian restaurant in Addis Ababa. So they're public health veterinarians teaching in the MPH program here at Cornell. So it was really great to get a chance to talk with them and kind of share the work that we were doing with each other. And when Karen learned that I had a shelter medicine background, she's like, oh, that's really cool. I have a lot of friends who are shelter vets. And she proceeded to drop some names. And I knew all of them, so that was exciting. And Elise Gingrich, I don't know if you're here. She said she was sorry she couldn't be here, her good friend Elise, and to tell you hello. So, so you showed up on her doorstep. Excellent. So Dr. Gingrich also, like myself, is an MPH. And I've seen an increasing number of MPH veterinarians working in shelters. Do any of you have MPHs besides Elise and I? A handful? Excellent. And hopefully at least had a public health class in veterinary school, as I did. But I think hopefully throughout this address you'll see really where those connections are and how interconnected it is. And I'm just amazed at what a small world it is, right? Halfway across the world I meet someone where both they're working on zoonotic disease, public health issues, and meet somebody who has so many connections with people that I'm also connected with. So shelter medicine and public health. A little bit about my background. I grew up in rural southern Ohio, beautiful hilly area. And I had kind of an unusual upbringing. My parents were very nostalgic and they wanted to kind of live life the simple way, which I don't know why they call it simple because it's a lot of work. But we raised all of our own food. So we had huge gardens and we put up food for the year. We had cows and pigs and chickens and ducks and horses and mules. And we raised all of our own food. I hand milked the cows, hand churned the butter, we ground the grain. to make bread, which we cooked in our wood stove, and we used our mules to help us bring firewood out of the woods. So anyway, you get the picture. It really was a fun way to grow up. But during that time, it became abundantly clear to me that I was destined to be a veterinarian. I knew that I wanted to be a veterinarian, and I went off to Ohio State to accomplish that dream. But what I didn't know was all of the things that veterinarians could actually do. I didn't understand all of the roles that we had. And I learned that as I went. So when I went to Ohio State, I had an interest in wildlife as well. Not necessarily zoo medicine, but more ecosystem health. So I was always kind of a big picture person. So that's what I did my undergrad in. And I went on to veterinary school. Decided that 4 or 8 more years of college was not in the cards for me, so abandoned my wildlife goals, and I took a position in small animal practice, as many of us do right out of vet school. And I really enjoyed a lot of it, but something really was kind of missing for me, and I didn't know what that was. I also was never really comfortable with my surgical skills. I actually graduated vet school without ever doing a spay. Back in the early 90s. I did several surgeries, so I had the basics, but I hadn't done a spay. I just wasn't comfortable with that. So I decided to volunteer at our local shelter and help them out with my hour spay, right? Woo! Come on in! And they welcomed me, which was great. And the veterinarian there had done a lot of surgery. She was a great mentor. And it must have improved because they offered me a job. And I took it. And I really fell in love with shelter medicine. During my time there. I remember kind of going through a shelter shock, right? I didn't have any idea what this was all about. And I wondered after we busted our butts all day, what on earth there could possibly be left to do tomorrow. But they're, as you know, they keep coming in and there's always more to do. Shelter medicine then, 25 years ago, wasn't even a thing, right? There were vets who worked in shelters, but shelter medicine wasn't a field. And it's been really amazing to get to see that field develop and even play some small role in helping to develop and see the professionalism grow. I couldn't even imagine a conference like this dedicated to shelter medicine 25 years ago, much less one that's going to be attended by so many shelter vets and shelter techs. So again, very exciting to see the changes over the years. So I worked in the Humane Society for a number of years. I practiced shelter medicine. I did a lot of surgery. I actually became quite addicted to neutering. I still sometimes get a little twitchy because it's been a while since I've gotten to neuter something. And I also was very actively involved in forensics and animal cruelty investigations, which I found really rewarding. One of the best things I think about being a shelter vet is all the variety of things that you get to do and see in your daily routines. In the late 1990s, the Ohio State University, because I was not the only person to graduate without doing a spay, started a shelter rotation for surgeries at our local animal control agency. So I thought that was a great addition to the veterinary curriculum. All the veterinary students spent 2 weeks at a local shelter performing spays and neuters, not getting just one, but a dozen or more under their belts than before they graduated. And because the animal control was all dogs, they wanted to have some cat experiences as well, so they started sending the students 1 or 2 days a week to the shelter where I worked. So I got the opportunity to supervise and teach veterinary students on anesthesia and surgery. And I found out that I really enjoyed education and that aspect of being a veterinarian as well. So a couple years later, when the position opened, I took a job at Ohio State leading that shelter surgery rotation. And then through 2003, we expanded that to be shelter medicine and surgery. So we added that medicine component, and we actually became the first core, so the first required rotation for shelter medicine in the United States, where all of the students came through to take this rotation. I was the medical director for that shelter during that time, and also a supervisor for this rotation, and the students who came through in groups of 8 every 2 weeks provided under our supervision all the medical and surgical care for that facility. So it was a really great experience. The students got a lot of experience developing their clinical skills, but also rounding on population medicine and several topics pertaining to directly to shelter medicine. That was very rewarding. One time in my career that I really still today look back on, and I'm very proud of that work. And I actually saw quite a bit of difference in our veterinary community as a result of that. Because at the time, there was a lot of hostility between community practitioners and shelter veterinarians in the area. And I started to see that change. And I remember the first time I got a call from a former student who was practicing in the area and said, "Hey, Dr. O, we had a dog that was just adopted and has kennel cough. I just wondered what antibiotics you recommended. I thought you might know, what's particularly working in your shelter." And it was a great conversation, asking for advice and not, "How dare you?" The typical thing that you usually get. So just seeing that shift and the better understanding of shelter medicine and the shelter's role in the community was really rewarding. And I think we still benefit from that today, in the Columbus area at least. So after a few years, I accepted a position with the Ohio Department of Health as Assistant State Public Health Veterinarian in their zoonotic disease program. And while we worked on a lot of different zoonotic issues, and we did surveillance and we did consultations with healthcare providers on diagnosing and managing exposures and potential cases and outbreak response, we were often referred to as the rabies program, because the majority of what we did was rabies. And I thought I knew rabies, right? We all study rabies in vet school. I'm like, yeah, I know rabies. And then I came to work there. And I found out how much I didn't know about rabies. But fortunately, I had some great mentors there as well, and a lot of good resources. And I learned a lot more about rabies. And I've been working actively with rabies both in the United States and internationally ever since then. While I was there, I went back to school. Several years had passed. I forgot what college was like. I went back to school and got my master's in public health. Ohio State has a veterinary public health specialization in their MPH program, and so I was fortunate to take that. And then once I completed that, I had the opportunity to come back to Ohio State and merge both of my passions, teaching shelter medicine and veterinary public health. So I jumped at that opportunity, and that's still where I am today, spending my time with kind of a foot in both the shelter world and the public health world. But I wanted to talk a little bit more about my transition from shelter medicine to public health. I was very concerned that this new field, I had spent so much time in shelters, would I be a good vet in public health? And I thought that it would be very new to me. And a lot of it was very new to me. I really didn't understand previously what the role of a veterinarian was in the public health workforce. And it's a very important, very diverse role. But it has a lot in common with shelter medicine. And I found that my time there actually prepared me pretty well, right? So we're population level medicine, disease surveillance, prevention and control, and we're concerned with community safety and health, right? So these same core things, shelter medicine and public health. I did a lot of zoonotic disease work, and I had a lot of zoonotic disease concerns. Fortunately, not a lot of cases, but at least concerns in the shelter. We needed to make sure that if there were a case, we recognized and managed it well so that we're not amplifying that in our shelter and then disseminating it into the community, calling attention to the public health department, who then might come and help us take care of that. So zoonotic diseases were definitely common in both of those areas. Animal cruelty actually has very strong roots with public health because we know the link, right? So we're going to see domestic violence in situations where animal violence is occurring and vice versa. So definitely a strong link there. Feral cat concerns, animal hoarding. The animals in our shelter population actually serve as disease sentinels for the rest of the community population of animals. Often veterinary clinics do to a lesser extent, but those animals are typically receiving veterinary care. A lot of our subpopulation don't have any of that veterinary care. There's a lot of strays, and so we can get a better picture of what's going on in the community. And I would remind you that the canine flu, when it jumped from the racetrack dogs into the pet dog population was first recognized in shelters in Florida. Now, I know that's not a zoonotic flu, but all flus are potentially zoonotic if they mutate. So all influenzas are a concern for public health, and they are closely monitored. But that's just a good example of how that shelters can serve as disease sentinels for diseases of public health concern, as well as diseases of concern to animals. Right? And public health and safety, so critically important in all of those things. So I wanted to talk a little bit about feral cat concerns, because there I was, new public health office, not on my feet all day anymore, which took a little while to get used to. And I got a lot of calls about feral cats. The public call health departments quite frequently to complain about cats in their area. And I talked with them. After coming from shelter medicine, where I was actively involved in TNR programs, I was a little surprised to learn that public health officials are typically not in favor of TNR programs or of feral cats in general. Similarly, wildlife officials have that same. Now remember, I have a degree in wildlife as well. So I kind of have to argue with myself about these issues, and I did actually. And I've talked with a lot of people on all sides of this issue, and it's been really interesting to hear the different perspectives. And when I talk with wildlife professionals or public health professionals, I'm often trying to convince them that there's value in TNR, and that given all the alternatives, this is the best one we have available to us at this point, and that it also provides an opportunity to get specifically rabies vaccine into these animals, which can help provide some protection to the public. We definitely know that there are public health concerns associated with lots of free-roaming animals, specifically cats in this case. We also know that those risks are exaggerated, just as the number of birds that they kill is exaggerated. But that doesn't mean that they're not there. Cats do kill birds, and there are public health risks associated with those free-roaming cats. Risk of bites and scratches, potentially of rabies exposures, and there have been several rabid cats associated with colonies over the last couple of years, and some of them have exposed people. So we do know that those risks are there and that they're real. Parasite deposition in the soils, all of these things are a concern. Again, they're over-exaggerated, but they're still there. So what I started to think about is, how can we reduce this risk, right? We're not going to eliminate all of the free-roaming cats. It's just not an option. And the question about whether or not they should be there is also a moot point in my mind, because they're already there. It doesn't matter whether you think they should be there or not. The question is, what are we going to do about them now that they are here? So often in supporting TNR, and I still support TNR, when I'm talking with wildlife and public health. But now that I'm talking to shelter veterinarians, I want to kind of bring a little bit of a public health perspective to it. And I'm not going to say that we should stop TNR. That's not my recommendation at all. But I am going to call up a question of, should we be feeding them as part of our colony caretaking responsibilities? And I know it's best practice to manage your colonies, and it makes sense that we want to feed them, right? But as a wildlife biologist, I have to ask, do they really need to be fed? They seem to be doing pretty well reproducing on their own without us feeding them. So maybe we can skip that part and still manage the colony's health and reproductive status, but maybe not provide food. And I'll share with you why I make this bold and controversial, share this thought with you now. Because when we provide food for the cats, we draw a lot more cats into a smaller area. And so we're concentrating the number of cats in an area where they might have been more spread out otherwise. They wouldn't normally hang out in those large of groups. They also have all of their food needs met, so they're less likely to roam and hunt. They're spending more time in those areas. They're depositing more fecal waste in those areas. And because we're lazy as human beings, we tend to feed them really close to where we live, right? So we're actually attracting them closer to us, closer to our residential areas. Some of the situations have occurred near bus stops where kids are waiting for to get on their school bus. And there's a feeding station very close by. So the kids go try to pet the cats and they get bitten or scratched. So I think to some extent we're almost creating more of a problem than there would be if we weren't feeding. So we're magnifying the concerns that our TNR opponents are worried about by the actions that we're taking. Does that make sense? So my recommendation as a public health shelter vet would be, yeah, let's spay and neuter everything we can. Let's monitor the health of these colonies. Let's vaccinate every cat that we can get for rabies. But maybe let's not feed them. Let's let them go back to where they were, back to their free-roaming state. Now, I know that that's going to be a hard sell, and I know that a lot of people feed cats outside of colonies because they like to feed the cats. It makes them feel good. So my recommendation there would be to maybe set up feeding stations that are more remote so that we're drawing that concentration of cats maybe away from where our kids are playing and where a lot of people are living as well. So public health really isn't about eliminating a source. Very rarely are we able to do that. It's more about managing that risk and reducing the risk. And I think that that consideration of those issues can definitely help reduce the concerns that the TNR opponents have. I'd also add that on the wildlife side, putting that food out draws in a lot of wildlife. And we have tons of pictures, right, of raccoons and cats sharing food bowls. So every time we bring more together and multiple species together, we're amplifying the risk for cross-species and between animal transmission of disease. So we're really kind of magnifying those risks. So, soapbox. I've been wanting to say that for a long time because I know it's not really out there. So you don't have to agree with me, but give it some thought and see what you think. That's the way I like to approach issues, is to come from all sides. What are the issues and concerns, and how can we address them the best way possible? So I was really excited to start public health and have this be one of the first issues that I was tackling. Actually, there were several municipalities that were considering feeding bans and feeding restrictions, so no food out at night and things like that. And so I was able to provide input and advice on those and other related issues for those groups. I also got a call from Canada when the bird article came out, the most recent one with all of the more birds are killed than are born in the United States every year. You know the one I'm talking about? If you look at their range of numbers of birds killed, at the high end it is more birds killed than there are birds that exist. So I got the chance to talk with the municipalities in Canada about that as well because they wanted to make some regulatory changes. So, feral cat concerns. Another call that I got was from a health department in Ohio who was responding to a couple respiratory cases in humane agents who had just conducted an animal hoarding rescue operation. And it turns out that I knew these guys personally from the work that I'd been doing in shelters, and it was very sad to hear that one of them had passed out in his car in the drive-thru where he stopped to get a drink of water on his way home and ended up in the hospital. So pretty severe respiratory complications. They were not wearing appropriate personal protective equipment to protect them from the risks that were in that environment, especially when they were in there stirring it up trying to catch 100 cats, right? Because they don't just walk up to you and climb in the crate, right? How many of you have been in a hoarding house? Right? They're running around, they're stirring everything up. So we did a consultation with the health department, really didn't feel comfortable making recommendations for them, so the veterinarians at the Ohio Department of Health served as that resource. And it turns out there was a similar situation in another state. So the National Association of State Public Health Veterinarians had a conversation about this very topic. Actually, one of the hoarding cases that was going on at that time in Washington State also had positive Brucella canis cases. So they had a lot of issues that they were concerned about at that site. But we got together with Gary Petronic and several state public health veterinarians and kind of reviewed what the risks are and made some recommendations based on those anticipated risks in the environment. And it was published in the Journal of Environmental Health if anybody's interested. And one of the things we learned was that we really didn't know a lot for sure. We made a lot of assumptions poop is gross, there's poop here, there's probably gross stuff here, those kind of things. But we really didn't know all that much about it. So when I came back to Ohio State and was working in the veterinary public health program, where we have a lot of graduate students who need to do research projects, I sent a couple out to do some sampling. And so we did air and surface sampling in a couple animal hoarding homes that our humane agents were able to write us in on the search warrants. And so we went. It was pretty interesting. We would love to do more. We just have a few houses, but our preliminary findings, I don't want to bore you with numbers, so I put generalities up here. But the fungus and mold counts in the air grew high numbers of colonies on plates, and we compared them to samples collected outdoors at the exact same time, and it was 114% higher indoors compared to outdoors, and that's not typically what you would expect to find in a healthy house. Similarly, our gram-positive bacteria on the mannitol plates grew 28 colony-forming units indoors compared to 35 outdoors. The air quality in this environment was abysmal. Particulate matter levels, this one really surprised me, especially the small ones that are respirable, which means a surgery mask, something like that, is not going to block them. They're going to go right down into the lower airways in your lungs, which I think contributed to the issues that we saw with my friends, because ammonia was an issue there, but not as high enough to explain all of the signs that we were seeing in those folks. But you get a synergistic effect between ammonia and particulate matter when it causes inflammation in the lungs. So for the houses that we measured, the particulate matter levels of those respirable particles were so high that if it was outside, the EPA would have issued an air quality alert. You guys have all seen those air quality alerts, usually in the big cities. Yeah, so they would have issued an air quality alert. So think about our humane agents and volunteers sometimes who are in these homes. Are they wearing adequate personal protective equipment? Are we preventing them from developing illness or injury as a result of these exposures? And not surprisingly, we found zoonotic bacteria and parasites everywhere we sampled, including on the primarily human contact surfaces. So tables, even inside the refrigerator, we found some of these things. So I think I don't have to tell anybody here, just assume that every surface is contaminated. But now we have proof, and we can say every surface is contaminated, even those that animals aren't typically using. So I was really excited to find out how much overlap there was between the work I had done in shelter medicine and now the work I was doing in public health. And sometimes as I learned more about it, I went, oh wow, I really shouldn't have been doing that when I was in the shelter. I have asthma, so walking into a house to see what the ammonia level is by checking to see if it causes wheezing, not recommended. Yeah, so not a good plan. Don't do that. Wear your personal protective equipment. But not only was I working with very familiar topics, I was also sometimes working with the exact same people that I had been working with in the shelter environment. So shelter medicine is public health. And shelter medicine really has its roots in rabies, right? So our animal control facilities, that whole infrastructure was developed because of rabies in dogs, specifically lots and lots and lots of free-roaming dogs. So what do we have in the U.S. now? We have licensing and registration, removal of stray dogs from the streets, control of reproduction, leash laws, waste removal. If they eliminated certain areas, you have to pick that up or you can be fined. Rabies vaccination requirements, and all of these have been incredibly effective at reducing free-roaming dogs in the United States and eliminating canine variant rabies from the dogs in the United States, which is a huge win. I think sometimes we don't recognize that here because we've been so fortunate not to have to deal with it, not to live in fear of the dogs that we see on the streets, at least not for fear of rabies. But when we go to Ethiopia and other developing countries, this is what we see. Large numbers of dogs living on the streets and a lot of rabies. So it's almost like taking a step back in time, right? So this is what it was like in the United States 150, 175 years ago. And we just didn't see that part of it. So I think the public health roots and still the public health efforts today aren't always obvious in the shelters. So I've been fortunate for the last 6 years to be involved with the Global One Health Initiative at Ohio State University and to be leading the rabies efforts that are going on in East Africa. And we have started with kind of getting the stakeholders together, so bringing agriculture and public health and the human health care providers and the veterinarians and the vaccine manufacturers and all of these partners together to talk about the best way to combat rabies. We've been doing this with a lot of zoonotic diseases as well, but we started with rabies as a poster child because we know how to eliminate rabies. We've done it in other countries. We know how to do it. We just don't know how to make it work in this specific country. So that's where we started. It's a marathon. We didn't get rid of it here in a decade, and we're not going to get rid of it in Ethiopia and other countries in a decade either. But we are making a lot of progress. And we've helped develop a national rabies control plan for the country that all of the parties, previously there had been several rabies control plans, one for each ministry, and they were all very different. Now there's one that they're all working together to implement, and they're piloting different parts of it as we speak. So that's been really exciting. Some of the training that we've been doing there has been in surveillance efforts. So they're not currently doing active surveillance for rabies. They're not testing suspects, human or animal. And that means that they really don't have the response that they need when there are cases. So it's very uncoordinated activities. Because that system is not in place, we've spent a lot of time working on capacity building and developing the infrastructure so that they can respond. So we don't go in and vaccinate a bunch of dogs and leave. We go in and teach them to vaccinate dogs and teach them to run a mass vaccination campaign. Because anybody who's conducted a vaccination clinic knows that there's a big difference between vaccinating a dog and vaccinating a couple thousand dogs, right? So there's a lot more to it than just the actual vaccination technique. We need to educate the community. We need to do sensitization. We need to manage the flow of people and dogs through a clinic. And actually, we've provided several trainings over the last couple of years, and that's what I was just doing last week. And actually, I heard from my team, I left a couple people behind to do some field work, and they vaccinated 1,000 dogs in 2 days with a pretty small team. So we were very excited about that. Sadly, we did have a bite, which is always a challenge. I will say that working there is even harder than working here because the veterinarians there and the public are afraid of the dogs. So it's not like I'm grabbing one of you and saying, here, come over here, let me show you how to hold this dog that maybe doesn't want to be restrained, taking people who are terrified of them and trying to overcome that fear. So it's really interesting, but it's so rewarding to see the difference when a couple weeks into a campaign, they're putting themselves out there and they're much more comfortable handling these dogs. We, last summer, did a 6-week training, and 4 weeks of it was actually providing mass vaccination to dogs in Addis Ababa. So we divided them up in teams, and we went through different regions trying to reach our 70% goal in each of those regions, and then following up with surveys to identify what our vaccination rate was so we could estimate to see how close we got. And over the course of that training, the supervision that we provided was scaled back so that we started with a lot of hands-on support, and at the end they were pretty much running it by themselves, and we were just there to troubleshoot if they needed anything from us. And they've continued to vaccinate after we left, vaccinating over 8,000 dogs in a couple months. Of course, there's 300,000 dogs in Addis Ababa, so 8,000 is great. We've got a long way to go yet. But during that 4 weeks in the field, we identified 5 rabid dogs just walking around. We're just walking around, going door to door, doing vaccination, and we identified 5 rabid dogs. One of them we found, my team found, I wasn't there for this, but they saw some kids running. And they're like, hey, I wonder what's going on there. And then an adult male, who it turns out had just been bitten by this dog, was running towards them, and the dog was chasing them. And one of our team was like, hey, let's catch that dog and vaccinate it. So caught him with the control pole, which was really great. And then as they learned more, and as they observed the dog, they found that he had bitten this adult male who owned the dog, and that he seemed to not be behaving normally. So he was euthanized, and he did test positive for rabies. So right then we stopped everything. We're providing advice on wound management, which is critical for preventing rabies, and then making sure that they all get to the hospital to receive post-exposure prophylaxis, which they did receive, and nobody contracted rabies from any of the dogs that we captured. But it makes it real, right? We talk about it, we watch videos, but we don't see rabid dogs very often. But there, it's a daily occurrence. So it's really can see the public health impacts of rabies and free-roaming dogs in these communities. And it makes you really appreciate what the sheltering system, along with a lot of other partners, has done here in the United States. But my sheltering background, I think, has really helped me a lot in these efforts to help provide advice as they're looking for ways to control these issues in their country, right? So developing rabies surveillance, and how are they going to respond to exposures in humans and in animals. Mass vaccination, I've already talked about that a little bit. It's really great. What we've been doing is not just, like I said, going and vaccinating and leaving, and not even just training some people and then leaving. We've been targeting their veterinary colleges, and we'll go in and train their faculty and then encourage them with their students to conduct rabies vaccination campaigns around their campus. So the animal handling skills that we're teaching them, the faculty are then continuing to teach their students that every year. So we're really, again, trying to get a lot of impact from the effort that we're putting into this, building capacity and infrastructure. I have some pictures, I didn't put it in here, but they tend to treat dogs like little cows. You know, here we are like, cats are little dogs, and then every professor says, no, they're not. Well, there they treat dogs like little cows, and they have these little stocks that they make for the dogs. It doesn't work well, right? So they think we're crazy when we're like, no, don't do that. But teaching them alternatives and better ways to restrain dogs. And even low stress handling works really well. They all think we're crazy, by the way, to walk up to some of these dogs. A humane dog population control. This is really critical. And this is something that we spend a lot of time talking with them about. Sometimes they want to go and build shelters. At this time in Ethiopia, as much as I love shelter medicine, I don't think that's the best option for them. There's not anybody to adopt. There's dogs everywhere. There's nobody who's going to come and adopt. They're not going to come and reclaim dogs for the most part. There might be a handful of people, but probably less than there are people reclaiming cats in the United States, because most of these dogs are community owned. They have a very different sense of ownership compared to us. We brought a group of veterinary students to Ohio State for a couple weeks to do some hands-on training and to show them agriculture and veterinary medicine in the U.S. And I took them on a tour of a shelter, and partway through, one of the guys says, wait a minute, so each of these dogs only has one owner? It was just mind-boggling. They couldn't wrap their heads around that. The community-owned dogs, people are not going to come to the shelter to pick them up. So building shelters to warehouse these dogs is not in the best interest of the dogs or the community. So I find myself in a strange position of discouraging that. Some of the countries are moving ahead with that. The Philippines is currently building shelters. Kenya has built some shelters recently and is asking for advice on how best to utilize those shelters. My recommendation to them was to turn them into high-quality, high-volume SpayNeuter clinics. So we'll see if that goes anywhere. There is anybody here who's involved in that, who's interested in training opportunities and working abroad. A lot of countries are asking for people to come in and train their vets to do SpayNeuter. And that's something that we've done in Ethiopia to a limited extent as well. But I mentioned the Philippines because their princess, somehow, I'm not sure what the backstory is, but she got really interested in rabies. And when the princess is interested in eliminating rabies, money flows. And so there's a lot of activity going on in the Philippines. They recently, with work of Global Alliance for Rabies Control, implemented a curriculum, like a K through 12 curriculum on responsible dog ownership, bite prevention, and what to do if you're bitten, rabies exposure, those kinds of things. So really excited to see what kind of an impact that's going to have. She's also built shelters, and they're kind of doing some warehousing of dogs. So they've been reaching out to get advice and input on how to provide the best care, maintain the health and welfare of the dogs in those facilities. So we are seeing some of that movement going on. So facility design, management, disease control, all those things that we use here every day in our shelters directly relate to what's going on in other countries who are just trying out some of these things to see how it helps with their dog population management. And SpayNeuter, it's great. We love it. It's expensive. And when there's not capacity in the country to support that, it's not an immediate tool that we can use. But that doesn't mean we can't work towards it. So we did put on a SpayNeuter training with the University of Gondar. We went and trained the surgery faculty. They do some large animal surgery, very limited, but I was surprised at how little surgery even their surgeons do. So there's not a whole lot of it. So it was a little bit of a lift to train them. And then we utilized them to help us train regional veterinarians who work for the government to perform SpayNeuter surgeries. So that was really interesting. One of the guys that I work with at Ohio State talks about working in Ethiopia and other countries, and he always says, maximum flexibility, minimum expectations. So that's something that we say a lot, and I really understood that a lot better after conducting SpayNeuter there. So here's just snapshots of some dogs that we saw on our travels in Gondar when we were doing our dog enumeration surveys. First thing is to find out how many dogs there are, right? But I found it very interesting how different they all look. And I can't tell you, I mean, I could have showed you 100 pictures and they all would have looked very differently. And it's not this typical little brown dog that you often associate with Africa. Anyway, this was our surgery suite. So it was rainy season. I didn't want to be outside. And one of the things we wanted to do was use what was available. We didn't want to bring in a bunch of stuff that they can't get. So we worked with the drugs that they're able to import. They don't have gas anesthesia, so we used injectable. And I asked for a roof. And I got a roof. Actually, it was a pretty good location for the most part. We had a lot of light from the windows. There was electricity, but it was kind of scary, so we tried not to use it. And then we went around the vet school and we just found tables, because I had sent them a list of everything I needed and nothing was there when I got there. So we found tables, took them out of people's offices and brought them in, but they were too short, so we went around the construction sites and gathered up these paint cans and used them to lift up. So where did I learn creative problem solving? In a shelter, right? If I'd come out of a high-end clinic or from Ohio State, I wouldn't have thought of any of these things, but I find this so fun, right? Go out and scavenge and see what you've got and what you can do. So we set up several surgery tables in here. This looks probably pretty familiar to any of you who've done surgeries like this. We didn't have gas anesthesia, but I did want to have an airway. So I brought trach tubes and bags so that we could provide air, at least room air, if needed, right? We had fluids and some other emergency drugs along with our typical anesthesia. And they drove around the community with a bullhorn and said, if you bring your dog for SpayNeuter, we will give you a rabies vaccine. We had a line by 7 a.m. It's way more than we could handle. So we had to send a lot of people home, but we were able to SpayNeuter. It was a training, and we did models before we did any hands-on stuff. So when I say 63 over 4 days, that was actually a lot for what we were doing, because we did a lot more than just the live surgeries. We had a vet tech, or not a vet tech, but a vet student who we use as techs that we brought for each dog. So we had constant live monitoring. We didn't have the electricity, we didn't have the machines, constant live monitoring. This is Dr. Belu, who's now my veterinary public health resident, getting ready to graduate in December and head off to do great things for dog welfare in the world. Here's one of our surgeries. Again, light, lots of light. We can see things so well. I say that because it's going to change. Having to be creative. So one of the things on my list was like old towels or old blankets. I wasn't thinking. This was early, right? Now I would know better than to ask for that. But then I didn't know better. There aren't any. They're all in use. So we really didn't have that to rely on. And we did have one dog who became hypothermic. And I needed to warm this dog up. She wasn't recovering real well. She was hypothermic. I wanted to warm her up. We were rubbing her. We had a coat that we threw over her. Wasn't helping. So I'm like, oh, hot water bottle, right? Yeah, not so much. No electricity, no microwave. So trying to think of different things, and I'm asking for, different ways for me to provide heat. And I said, I need hot water. And they said, tea? And I said, no, hot water. And they said, tea? Coffee? And I said, tea. Bring me tea. Bring me 8 cups of tea. And they're like, okay. And they had to go start a fire. And they got the water boiling. And then they brought me a bunch of tea. They're looking at me like I'm insane. And they brought me sugar for my tea. And I'm like, I don't need sugar. I just need tea. So I took a bunch of surgery gloves and put the hot tea in the surgery gloves and used them to warm this dog up. It worked really well. So tea. Every time we go now, we get tea and we reminisce about our surgery gloves. So you have to be creative sometimes. Here she is. She's starting to move around. This was the surgeon, Tamaru Baran, who did the surgery on her. He was so dedicated. He stayed with her, and he actually took her home with the owners. So the owners waited for the surgery to be done. He went with them home to make sure that she was still doing okay after she went home. Tea. Tea. All right, so just another quick shot there. And on our very last day of surgery, it got dark because it's rainy season and it was storming all day and we couldn't see very well. So what did we do? We had the vet students whip out their cell phones and they're standing here and they're holding the light over the surgery site so we could see to finish our surgeries. And that worked pretty well. And then somebody's like, hey, Dr. O, there's water coming in under the door. Like, well, that's not good. So we watched it and it actually started spreading really quickly. Here's a dry spot by the time we grabbed the camera. It started spreading pretty quickly. Here it's getting a little bit deeper. We're picking up things and getting them up off of the ground. And it wasn't very long after this when I looked out a window and I saw that. And I said, we're out of here. So we were in that little concrete building that you saw. The door was the only door. And it faced this stair step. We were at the bottom of the hill and all this water was coming down and rushing in. And so I said, okay, we're evacuating. Fortunately, we had dogs that were sedated. We had dogs that were recovering, but fortunately we didn't have anybody open at that particular time. So I'm like, grab the dogs. And we grabbed a few other things, as many gowns as we could to wrap them in. And as soon as they opened the door, the water rushed in. And then it was knee high. And somewhere I have a picture, but I couldn't find it, of those paint cans bobbing in the water. I'm like, no. But we got out, and as we're stepping out to carry the dogs up, we had to go up these stairs to the veterinary administrative building up here. As we're carrying them up, I'm like, keep the trach tubes above the water. Never thought I was going to have to say that ever in my life, right? But we carried them up there. They were amazed. Afterwards, they said, we can't believe how much you cared about the animals. Like, that impacted their veterinary college community, just observing how we handled that. They're like, we would have ran and left them. Like, they wouldn't have even thought about them. But they said, you guys made sure they all got out. And then we took them in and we were trying to warm them up because they got wet. And they still were under some of them. And I have to say, for Ethiopians who said that they probably would have run and left them if it hadn't been for us, they started ripping curtains off of the walls out of the vet school to wrap the dogs in, because actually they wrapped me in it. And then I took it off and I wrapped the dog in it. And then they went and grabbed some more, and we got all the dogs warmed up, recovered, and sent home after that. Unfortunately, that was our last day of surgery because everything that we had was ruined in that flood, which is too bad. Well, everything we couldn't clean and disinfect. Right? So maximum flexibility, minimum expectations. That's Dr. Gabrea's motto. And for me, what I brought that I learned in shelters was creative problem solving and working with what you have available so that you can make these things happen. Right? Really what I want to leave you with is that shelter medicine is public health. Every day in the shelter, you're practicing public health. Everything that the shelters do has some root in public health. Clearly, on our municipal animal control facilities, it's obvious, right? They came about because of rabies and dog control. But even the humane societies, welfare is important, absolutely. But every unwanted animal that is brought in for rehoming is one less that's on the street. So it's not just animal control. All of the shelters are involved in public health. And you can see here some before and after pictures on the streets today. We haven't completely eliminated the problem in the U.S., but certainly shelters are standing there and doing something about it. So thank you so much for your time. I'm happy to answer any questions.